السلام عليكم. دكتور عمر الفاتح, maxillofacial surgeon. The last entity we have is soft tissue cysts. Mainly we'll be talking about the clinical features and histopathology of soft tissue cysts. The first one is cervical lymphoepithelial cyst. Cervical lymphoepithelial cyst, termed as branchial cleft cyst or benign cystic lymph node. This cyst becomes apparent in late childhood or early adulthood. It is painless swelling, takes place in lateral aspect of the neck, anterior to the sternocleidomastoid muscle. Draining fistula that communicates between the cyst and the overlying skin occasionally develops. As we mentioned earlier in the last topic of primary bone cyst, the inferior alveolar canal was a landmark there to differentiate between the cysts. Here in the neck lesions, you have midline lesions, you have a lateral lesions, and here the sternocleidomastoid muscle is our landmark. The cysts take place anterior to the sternocleidomastoid muscle. It is lateral, not midline. And obviously, as we can see and notice, it takes place anterior to the sternocleidomastoid muscle, can have a draining fistula, communicate between the cyst and the overlying skin. And sometimes it gets worse when the person have an upper respiratory tract infection. It gets enlarged. The second entity is thyroglossal duct cyst or thyroglossal tract cyst. The thyroglossal tract cyst is a relatively uncommon lesion that is derived from embryological remnants of the thyroglossal tract. 70 to 80% occur below the hyoid bone, primarily in children and young adults. It is asymptomatic, slowly enlarging, mobile, particularly with swallowing, involving the midline of the anterior neck. Small percentage can happen in tongue, and when it happens, it can cause dysphagia. Now, we mentioned that it takes place from the remnant of thyroglossal duct. The thyroglossal duct takes place from the posterior tongue to the thyroid gland. So basically, it can happen anywhere on that tract, from the tongue to the hyoid bone to the thyroid, but 70 to 80% of the cases takes place below the hyoid bone. It can take place in the tongue. When it happens in the tongue, it can cause dysphagia, and it is the distinguishing criteria of it that if you ask the patient to swallow, it will move. It is mobile with swallowing. Okay? Just ask the patient to swallow and keep your eye on it. The cyst is lined by stratified squamous epithelium, ciliated columnar epithelium, or transitional epithelium. The cyst capsule can exhibit a number of additional findings, including lymphoid aggregates, thyroid tissue, mucus gland, and sebaceous gland. Carcinoma can occasionally develop from the lining of thyroglossal tract cyst and from remnant of thyroglossal tract. Takes place in the midline, as we mentioned, and the diagnostic clinical feature that it is mobile with swallowing. Dermoid cyst, the third type of cyst that we will discuss, represents a simple form of cystic teratoma derived from germinal epithelium entrapped during embryonic development. Most of these cysts occur in the head and neck region, primarily in the skin around the eyes and the anterior upper neck, extending superiorly into the floor of the mouth. Clinical features happens in young adults, no gender predilection, anterior upper neck or floor of the mouth, painless swelling that is 2 centimeters or less in diameter. It is duffy in consistency, takes place above the mylohyoid muscle, and causes elevation of the tongue and can interfere with eating and speaking. Or can take place below the mylohyoid muscle and appear in the midline as a double chin. So here in the dermoid cyst, our landmark is the mylohyoid muscle. If it takes place above the mylohyoid muscle, it will raise the tongue and causes difficulty in eating and speaking. If it takes place below the mylohyoid muscle, it will be showing in the midline as a midline swelling and causing double chin. A layer, the histopathology, we will find a layer of orthokeratinized squamous epithelium exhibiting variable numbers of dermal appendages, including hair follicles, sebaceous glands, and associated erector pili muscle. The cystic lumen is generally contain a mixture of the squamated keratin, sebum, and hair shafts. Now, the fourth entity that we will be talking about is the epidermoid cyst. Before we go to the epidermoid cyst, in the dermoid cyst, we highlighted the dermal appendages, okay? Let's move to the epidermoid cyst. A cyst of skin with a lumen lined by keratinized stratified squamous epithelium, usually filled with keratin and without skin appendages in the capsule wall. So the main difference in the histopathology that will make us differentiate dermoid cyst from epidermoid cyst is the skin appendages. Skin appendages takes place in the dermoid cyst. In epidermoid cyst, they do not exist. The fifth cyst, surgical ciliated cyst of maxilla. The surgical ciliated cyst of the maxilla is an iatrogenic cyst that develops as a result of surgery involving the maxillary sinus, usually a Caldwell-Luke operation. Iatrogenic is a term that describes something that took place due to medical interference. The surgical ciliated cyst is iatrogenic by definition, and it develops after surgical procedures involving the maxillary sinus, mainly Caldwell-Luke operation. The cyst develops from maxillary sinus lining that becomes implanted in the maxillary bone at the site of surgical entry into the sinus. It happens in middle age or older adult, discovered during radiographic investigation, pain or tenderness in the maxilla. The patient's history usually discloses previous surgery involving the maxillary sinus. You have to dig in history. Having a previous surgery is mandatory. Having a previous surgery is mandatory to be found in the history of the patient to diagnose a surgical ciliated cyst. Radiographically, the lesion presents as a well-circumscribed radiolucency in close proximity to, but separate from, the maxillary sinus. The cyst is lined by pseudostratified ciliated columnar epithelium exhibiting the feature of maxillary sinus lining. The surrounding connective tissue may be normal or may exhibit some degree of chronic inflammation. Thank you very much for having me in this course. Thank you.